July 10th, 2022, just before midnight. An operating room at the Hospital da Mulher in São João de Meriti, on the outskirts of Rio de Janeiro, Brazil. A woman lies on a surgical table. She is about to give birth. A team of surgeons and nurses prepares on one side of a sterile curtain to deliver her baby by cesarean section. On the other side of that curtain sits the anesthesiologist. His name is Giovanni Quintella Bezerra. He is 32 years old. He finished his anesthesiology training just 2 months ago. And right now, the woman on that table cannot see him, cannot feel him, cannot resist him, because he has sedated her far beyond what is medically necessary. She is completely unconscious. Her husband has been told to leave the room. The surgical team on the other side of the curtain cannot see anything above her neck. And what Giovanni Quintella Bezerra does next, in those minutes, while his colleagues deliver a newborn baby just feet away from him, would be captured on a hidden camera that hospital staff placed in that operating room, specifically because they suspected this man was doing something monstrous to his patients. They were right. What the camera recorded would shock an entire nation, spark protests across Brazil, and expose one of the most horrifying betrayals of medical trust in modern history. Because the person responsible for keeping this woman safe during the most vulnerable moment of her life, the person she trusted to manage her pain and protect her consciousness, was the person who weaponized that trust to assault her while she lay helpless on a table, giving birth to her child. He is resourceful, doesn't show much concern when committing the crime. There is an abuse of power. Let's avoid calling him sick. The Hospital da Mulher Heloneta Stuttgart sits in the Baixada Fluminense, a densely populated working-class region on the outskirts of Rio de Janeiro. It is a public women's hospital. The patients who come here are not wealthy. They do not have private doctors or boutique birthing suites. They come because this is where the public health system sends them when they are about to have a baby. They come because they have no other option. And they come trusting that the medical professionals inside those walls will treat them with the care and dignity that every human being deserves during childbirth. Giovanni Quintella Bezerra arrived at this hospital as a newly credentialed anesthesiologist. On paper, he was exactly what any hospital would want. Young, recently trained, available for the grueling overnight shifts that more experienced doctors avoided. He had completed his residency in April 2022, just 2 months before everything unraveled. 2 months. That is how long it took for the nurses who worked alongside him to realize something was deeply fundamentally wrong. It started with the sedation levels. During a routine cesarean section, most women receive a spinal or epidural block. They are awake. They can feel pressure, but not pain. They can hear their baby's first cry. They can hold their child in the minutes after birth, begin the skin-to-skin bonding that medical science considers essential. That is the standard. That is what is supposed to happen. But the women who had cesareans under Giovanni Bezerra's care were not awake. They were not aware of anything. They were unconscious, deeply sedated, unable to respond, unable to hold their newborns, unable to breastfeed in those critical first hours. Nurses noticed this pattern and it troubled them. Why was this anesthesiologist putting his patients under so heavily? Why were these mothers waking up hours later, groggy and disoriented, having missed the birth of their own children? Why did he routinely ask the husbands to leave the operating room mid-procedure? The nurses talked among themselves. They compared notes. They watched him during surgeries and noticed something else. The way he positioned himself behind the surgical curtain. The way he arranged his gown to widen his silhouette, blocking the view of the patient's upper body from everyone else in the room. The way he leaned in close to the unconscious women. At least one nurse reported seeing him appear to become physically aroused during a procedure. These observations accumulated over weeks until the nursing staff reached a conclusion that no medical professional ever wants to reach about a colleague. They believed Giovanni Bezerra was sexually assaulting his patients while they were unconscious on the operating table, but believing it and proving it were two very different things. On July 10th, 2022, Bezerra was scheduled to perform anesthesia for 3 cesarean sections. The nurses devised a plan. They could not confront him with suspicion alone. They needed evidence. So they changed the delivery room for his 3rd procedure at the last minute, switching to a room where they had hidden a cell phone inside a cabinet, its camera pointed at the head of the surgical table, the area behind the curtain where Bezerra would be sitting alone with the sedated patient. The first 2 surgeries that day were performed in rooms where the nurses could not set up recording equipment. They watched Bezerra during those procedures with growing dread, unable to see clearly what was happening on his side of the curtain, unable to do anything but wait for the 3rd surgery and the hidden camera. The 3rd patient arrived, a woman about to deliver her baby. She was given anesthesia by Bezerra. She lost consciousness. Her husband was told to leave the room. The curtain was drawn. The surgical team began the cesarean on one side. Bezerra sat on the other, alone with the patient from the neck up. The camera was recording. What that camera captured over the next approximately 10 minutes would become the most widely discussed piece of criminal evidence in Brazil that year. The footage showed Bezerra positioning himself near the unconscious woman's head. It showed him assaulting her while his colleagues worked to deliver her baby just feet away on the other side of the curtain. When he finished, the camera recorded him taking gauze and cleaning the patient's mouth to remove evidence of what he had done. The nurses who later watched the footage were horrified, but not surprised. Their suspicion had been confirmed in the most devastating way possible. They contacted police delegate Barbara Lomba immediately. Officers arrested Giovanni Quintella Bezerra in the early morning hours of July 11th, still at the hospital, still in his scrubs, still carrying the credentials that gave him unrestricted access to unconscious women. His expression when the arrest was made, according to Delegate Lomba, was one of surprise. Not guilt, not shame, surprise that he had been caught. He is resourceful, does not show much concern when committing the crime, Lomba told the press. There is an abuse of power. Let's avoid calling him sick. That distinction mattered. Bezerra was not experiencing some uncontrollable compulsion. He was making calculated decisions. He chose which patients to sedate more heavily. He chose when to ask husbands to leave. He chose how to position his body and his gown to block the view. He chose to clean the evidence afterward. Every step was deliberate. Every step was designed to allow him to continue doing what he was doing without getting caught. Within hours of Bezerra's arrest, the scope of the investigation expanded rapidly. Police announced they were examining approximately 40 surgeries that Bezerra had participated in during his brief 2-month tenure at the hospital. They were particularly focused on the 2 cesarean sections he had performed earlier that same day, before the hidden camera was in place. Had he assaulted those patients too? The nurses who had watched him during those procedures believed he had. Then other women began coming forward. Tamires Souza Reis da Silva Ribeiro, 23 years old, had been treated by Bezerra on July 5th, 5 days before the filmed assault. She had come to the hospital to deliver twins. One baby was born naturally, but the second required an emergency cesarean. Bezerra administered the anesthesia. Tamires later told the Brazilian newspaper O Globo that she was sedated so completely that she could not witness the birth, could not see her son, could not hold him. The baby, born premature, died the following day. When Tamires' mother visited her after the surgery, she noticed something strange. Her daughter's face was sticky and shiny, covered in white stains. "I realized when she got to the room that she had some stains," the mother said. "I didn't know what they were. I even thought it was a medicine that had been put on her face." When the family saw the news about Bezerra's arrest, when they saw his face on television, they understood what those stains were. Tamires' husband, Wagner, said that Bezerra had forced him to leave the delivery room during the procedure. "He did not tell me why," Wagner said. "I did not argue because I thought it was a normal procedure. He learned what happened to his wife through the television. He recognized the doctor on the news." 3 more women treated on different days came forward with accusations, bringing the total to at least 6 potential victims. The Brazilian Society of Anesthesiology immediately expelled Bezerra from its membership. "Today he is no longer an anesthesiologist," a spokesperson said. "Since a meeting held last night, it was decided to suspend him indefinitely, so he's a former anesthesiologist." The Regional Council of Medicine launched an internal inquiry. In December 2023, the Federal Council of Medicine permanently revoked his license. He would never practice medicine again. Bezerra appeared in court for the first time on July 12, 2022. A judge ordered him held in indefinite detention in solitary confinement while the investigation proceeded. He was transferred to Bangu, Brazil's largest and most notorious prison complex on the western edge of Rio de Janeiro. The facility holds some of the country's most dangerous inmates, drug traffickers, cartel leaders, convicted murderers. When Bezerra arrived that evening at 9:15, television cameras captured the sound of prisoners booing, banging their cell bars, and jeering at him. Even among convicted criminals, what Giovanni Bezerra had done was considered monstrous. Social media posts uploaded by Bezerra before his arrest revealed a vain man prone to bragging, someone who frequently posted photographs of himself in medical scrubs from inside the hospitals where he worked. He projected competence, confidence, success. None of it was real, all of it was performance. And behind that performance was a man who had obtained the power to render women unconscious and used that power to assault them while their children were being born. The investigation also revealed that this was not Bezerra's first encounter with medical negligence. Before he qualified as an anesthesiologist, while working at a different hospital, he and another doctor had been accused of misdiagnosing a case of swine flu as a urinary tract infection. The female patient told she was physically fine and that her symptoms were caused by anxiety, was eventually correctly diagnosed with severe pneumonia after her lung function dropped to 25%. She fell into a coma that lasted 23 days. When she woke, she had lost her right big toe, sustained nerve damage in her knee, lost most of her hair, and suffered permanent mobility issues. A malpractice lawsuit had been filed. It was still pending when Bezerra was arrested for rape. The case ignited a firestorm across Brazil. Women took to the streets in protest. Medical associations issued statements condemning the assault and calling for stronger protections for patients during surgical procedures. Lawmakers demanded investigations into how hospitals enforced or failed to enforce patients' legal right to have a companion present during labor and delivery, a right guaranteed by Brazilian federal law. The Rio de Janeiro Public Defender's Office revealed that the Hospital da Mulher had adopted protocols to protect patients, but had failed to enforce them. Healthcare professionals at the hospital had normalized the practice of asking companions to leave during procedures, creating exactly the kind of isolation that Bezerra exploited. Think about that. Brazilian law specifically guarantees a woman the right to have a companion present throughout labor and delivery. That law exists precisely to prevent the kind of vulnerability that Bezerra weaponized, and the hospital where he worked had simply stopped enforcing it. Partners were told to leave because the doctor said so. Nobody questioned why. Nobody found it strange. The protocol that might have prevented everything was sitting in a binder somewhere, written down and ignored. The question that haunted everyone, from the nurses who set up that hidden camera, to the families of his victims, to the millions of Brazilians who watched the story unfold on the news, was simple and terrible. How many? Bezerra had been an anesthesiologist for only 2 months, but he had been in the medical system for years. He had access to sedatives, to operating rooms, to unconscious patients, long before he received his final credential. The police investigated roughly 40 procedures. How many of those patients were victimized? How many women walked out of that hospital carrying the evidence of assault on their faces, in their mouths, on their skin, and never knew what happened to them because they were unconscious at the time? The victim in the filmed assault later told investigators that she could not remember everything, but recalled Bezerra whispering in her ear, asking if she was okay. She thought it was a drug-induced hallucination. It was not a hallucination. It was a predator checking whether his victim was sufficiently sedated to continue. Giovanni Quintella Bezerra was convicted of rape of a vulnerable person, 2 counts for assaults on 2 patients. The Second Criminal Court of São João de Meriti sentenced him to 30 years in prison in closed regime, the most restrictive classification in the Brazilian penal system. The court denied his defense team's request to allow him to appeal while free. He was also ordered to pay 50,000 reais in moral damages to each victim. The sentence reflected the severity of what Brazilian law categorizes as rape of a vulnerable person, a charge that carries heavier penalties precisely because it involves victims who cannot consent, who cannot resist, who are utterly dependent on the person attacking them. As of this writing, Bezerra remains incarcerated at the Pedrolino Werling de Oliveira prison within the Bangu complex, where he has been held since the night of his arrest, when inmates made clear exactly what they thought of him. 30 years for 2 confirmed victims. But the real number, the number that investigators believe but cannot prove, the number that haunts the nurses who finally decided they had seen enough and hid a phone in a cabinet, is almost certainly higher. Some of those women may never know what happened to them. They went into an operating room to give birth. They were sedated by a man they trusted because he wore scrubs and carried a credential. They woke up hours later, disoriented, confused, unable to hold their newborns, and they were told this was normal. This is what happens sometimes. You were heavily sedated. You'll feel better soon. And they went home with their babies and never knew. The nurses who caught Giovanni Bezerra are the reason this story has an ending, not a happy ending. There is no happy ending when a woman is assaulted during childbirth, but an ending where the person responsible is behind bars for 30 years, where his medical license no longer exists, where he will never again stand on the other side of a surgical curtain with an unconscious patient. Those nurses noticed what no one else noticed. They paid attention when paying attention was uncomfortable, when the conclusion they were reaching about a colleague was so disturbing that it would have been easier to look away, to convince themselves they were wrong, to assume the best about someone in a white coat. They did not look away. They switched the operating room at the last minute. They hid a phone in a cabinet. They pressed record. And they watched the footage that confirmed their worst fears. Footage so horrifying that the lead investigator would later say she had never seen anything like it. There is a moment during every cesarean section when a woman is at her most vulnerable. She is on a table, unable to move, her body opened for surgery, her consciousness handed over to a stranger whose only job is to keep her safe and comfortable. She cannot see what is happening behind the curtain. She cannot move her arms. She cannot speak, cannot scream, cannot fight. She trusts that the person managing her sedation is there to help her, not to hurt her, not to exploit the total helplessness that anesthesia creates. Giovanni Quintella Bezerra understood that helplessness. He understood it better than anyone in that operating room because he was the one who created it. He controlled the dosage. He decided how deeply each woman would sleep, how long she would be unconscious, how completely she would be at his mercy. He used the very tool that was supposed to protect her from pain as the mechanism that made her vulnerable to assault. The sedation was the weapon. The surgical curtain was the cover. The gown was the disguise. And the trust that every patient places in every anesthesiologist every time they undergo surgery was the door he walked through to commit his crimes. That trust is not easily rebuilt. Every anesthesiologist in Brazil felt the ripple from this case. Colleagues with impeccable records found patients looking at them with doubt and uncertainty. The overwhelming majority of medical professionals are exactly what they appear to be: dedicated, ethical, committed to the care of their patients. But one man in one hospital in one operating room proved that the system designed to protect patients during their most vulnerable moments could be turned against them by the very person operating it. The nurses knew, they watched, and they knew. And when they could not prove it any other way, they hid a camera in a cabinet and let the truth reveal itself. That is the only reason Giovanni Quintella Bezerra is in prison today. Not because the system caught him, not because oversight protocols worked, not because a supervisor flagged the unusual sedation levels, because a group of nurses trusted their instincts, refused to look away, and made a decision that took more courage than most people will ever be asked to summon in their professional lives. They set up a camera, they pressed record, and they saved every woman who would have been on that table tomorrow and the day after that, and every day after that for as long as Giovanni Quintella Bezerra was allowed to hold a syringe and stand behind a surgical curtain with a woman who could not open her eyes.